Top 25 NHS Mental Health Nurse Interview Questions and Answers. In this video, we will explore the top 25 interview questions commonly asked for NHS mental health nurse positions. These questions are designed to assess your skills, experience, and suitability for the role within the NHS. We will also provide insightful answers to help you prepare effectively. By understanding these questions and responses, you can enhance your confidence and readiness for the interview process. 1. What motivated you to pursue a career in mental health nursing? My passion for mental health nursing stems from a deep desire to help individuals navigate their struggles and find hope. Personal experiences with friends and family facing mental health challenges highlighted the importance of compassionate care and support. I witnessed the profound impact that dedicated nurses can have on patients' lives, which inspired me to join this field. I am driven by the opportunity to advocate for those who may feel voiceless, promote recovery, and contribute positively to the mental well-being of my community. 2. How do you stay updated on the latest developments in mental health care? To stay updated on the latest developments in mental health care, I regularly engage with professional journals and attend relevant conferences and workshops. I also participate in online forums and webinars where experts share their insights and research findings. Networking with colleagues and joining professional organizations allows me to exchange knowledge and best practices. Additionally, I follow key thought leaders and organizations on social media, which helps me stay informed about emerging trends, treatment approaches, and policy changes in mental health care. 3. Can you describe a challenging situation you faced with a patient and how you handled it? One challenging situation involved a patient exhibiting severe agitation and aggression due to a recent traumatic event. I approached the situation with calmness, maintaining a safe distance while using a soft tone to communicate. I actively listened to their concerns, validating their feelings, which helped de-escalate their distress. I collaborated with my team to create a safety plan, ensuring the patient felt supported. Following this incident, I reflected on the experience and participated in additional training on trauma-informed care to enhance my skills in managing similar situations effectively. 4. How do you maintain professional boundaries with patients while still building rapport? Maintaining professional boundaries is essential in mental health nursing, as it ensures a safe environment for both patients and nurses. I establish clear expectations from the outset, communicating the limits of the professional relationship. Building rapport involves active listening, empathy, and genuine interest in their experiences while remaining objective. I engage with patients respectfully, allowing them to express their feelings and concerns without crossing personal boundaries. Regular supervision and self-reflection help me stay aware of my emotional responses, ensuring I remain professional yet compassionate in my care. 5. What strategies do you use to de-escalate potentially violent situations? In managing potentially violent situations, I prioritize communication and active listening. Establishing a calm presence is crucial. I use a soothing tone and maintain open body language. I assess the situation by observing verbal and nonverbal cues, which helps identify triggers. Offering choices empowers patients, reducing feelings of helplessness. I also employ techniques such as distraction or redirecting focus to safer topics. If necessary, I involve additional staff to ensure safety while reinforcing that the patient's feelings are valid and respected, promoting a sense of security. 6. How do you approach working with patients who have dual diagnoses? Working with patients who have dual diagnoses requires a comprehensive and integrated approach. I prioritize building a strong therapeutic relationship, which fosters trust and open communication. This enables patients to feel safe discussing their challenges. I collaborate with multidisciplinary teams to create individualized treatment plans that address both mental health and substance use issues. Utilizing evidence-based interventions, I focus on harm reduction strategies, psychoeducation, and skill-building activities. Regularly assessing progress and adapting the treatment plan ensures that the patient receives holistic care tailored to their unique needs. 7. Can you explain your understanding of the recovery model in mental health care? The recovery model in mental health care emphasizes the individual's journey towards healing and personal growth, focusing on their strengths and resources rather than just symptoms. It supports patients in gaining control over their lives, promoting hope, and encouraging active participation in their treatment. This model recognizes that recovery is a unique and personal process that can involve various pathways and timelines. By fostering an environment of support, collaboration, and empowerment, mental health professionals can help patients identify goals and develop skills necessary for achieving a fulfilling life beyond mental health challenges. 8. How do you ensure patient confidentiality and data protection in your work? Ensuring patient confidentiality and data protection is a fundamental aspect of mental health nursing. I adhere strictly to legal frameworks such as GDPR and the Mental Health Act, which guide data handling practices. Regular training on confidentiality protocols helps maintain compliance. I ensure that patient information is stored securely, accessed only by authorized personnel, and shared only when necessary for care, always with the patient's consent. Additionally, I educate patients about their rights regarding their data, fostering trust and transparency in our therapeutic relationship. 9. What experience do you have with risk assessments and care planning? Risk assessments are crucial in mental health nursing, as they help identify potential dangers to patients or others. I have conducted comprehensive risk assessments that involve evaluating the patient's history, current mental state, and environmental factors. This includes collaborating with multidisciplinary teams to develop individualized care plans that address identified risks while promoting patient safety. I regularly review and update these plans based on the patient's progress and changing circumstances, ensuring that interventions remain relevant and effective. My experience has taught me the importance of communication and documentation throughout this process. 10. How do you collaborate with other healthcare professionals in a multidisciplinary team? Collaboration within a multidisciplinary team is essential for providing comprehensive mental health care. I actively engage in regular team meetings where we discuss patient progress, share insights, and develop coordinated care plans. I prioritize open communication, ensuring that all team members, including psychologists, social workers, and psychiatrists, contribute their expertise. Building strong relationships fosters a supportive environment, allowing us to address complex cases effectively. I also value feedback and encourage a culture of mutual respect, which enhances overall patient outcomes and promotes a holistic approach to treatment. 11. Can you describe your approach to supporting patients with medication management? Supporting patients with medication management involves a comprehensive and empathetic approach. I prioritize education, ensuring that patients understand their medications, including purposes, dosages, and potential side effects. Regular check-ins are essential. During these sessions, I encourage open communication, allowing patients to express concerns or ask questions. Collaborating with pharmacists and other healthcare professionals enhances medication safety. Personalizing reminders and utilizing technology can also empower patients to adhere to their regimens, fostering independence and confidence in managing their mental health. 12. How do you handle the emotional demands of working in mental health? Working in mental health can be emotionally taxing. I manage these demands by prioritizing self-care, including regular exercise, mindfulness practices, and maintaining a healthy work-life balance. Engaging in supervision or peer support allows me to process difficult experiences and gain perspective. I also set realistic expectations for myself and recognize that it's okay to seek help when needed. Keeping a reflective journal helps me articulate my feelings and experiences, which can alleviate emotional burdens and foster personal growth. Building a strong support network is crucial for resilience. 13. What strategies do you use to promote patient autonomy and independence? Promoting patient autonomy and independence involves several key strategies. First, I prioritize open communication, allowing patients to express their preferences and concerns. Active listening helps me understand their goals, which I incorporate into care plans. Education plays a crucial role. I provide information about treatment options, empowering patients to make informed decisions. Encouraging self-management through skill-building activities boosts their confidence. Lastly, I collaborate with patients in setting achievable goals, reinforcing their sense of agency and encouraging ownership of their recovery journey. 14. How do you address cultural sensitivities when providing mental health care? Addressing cultural sensitivities in mental health care involves understanding and respecting diverse cultural backgrounds. It starts with active listening, allowing patients to express their cultural beliefs and practices freely. Training in cultural competence is essential for healthcare professionals to recognize their biases and improve communication. Incorporating culturally appropriate interventions, such as traditional healing practices, can enhance patient engagement. Building trust through empathy and respect fosters a supportive environment, encouraging patients to share their experiences and seek help without fear of judgment. 15. Can you explain your understanding of the Mental Health Act and its implications for patient care? The Mental Health Act is a crucial piece of legislation that provides a framework for the treatment and care of individuals with mental health disorders. It ensures that patients' rights are protected while allowing for necessary interventions when they pose a risk to themselves or others. Key principles include the right to be treated with dignity, the importance of informed consent, and the need for regular reviews of patient status. Its implications for patient care include the requirement for mental health professionals to balance patient autonomy with safety, ensuring that interventions are both ethical and legally compliant. 16. How do you approach working with families and carers of mental health patients? When working with families and carers, I prioritize open communication and collaboration. I actively listen to their concerns and educate them about the patient's condition and treatment options. Involving them in care planning helps foster a supportive environment. I also provide resources and guidance on how they can assist in the patient's recovery journey. Empathy is key. Understanding the emotional toll on families allows me to address their needs while ensuring they feel valued as part of the care team. Building trusting relationships enhances patient outcomes. 17. What experience do you have with cognitive behavioral therapy or other therapeutic approaches? I have extensive experience utilizing cognitive behavioral therapy, CBT, in my practice. I completed a specialized training program that equipped me with the skills to effectively implement CBT techniques. I have used CBT to help patients identify and challenge negative thought patterns, which has been beneficial in treating conditions such as anxiety and depression. Additionally, I incorporate mindfulness-based approaches and motivational interviewing to enhance patient engagement. These therapeutic approaches not only empower patients but also promote a collaborative environment where they feel supported in their recovery journey. 18. How do you stay motivated in a challenging work environment? Staying motivated in a challenging work environment requires a combination of self-care, support systems, and a focus on the impact of my work. I prioritize regular reflection on my achievements and the positive changes I make in patients' lives. Engaging in professional development and training helps me feel competent and confident. Connecting with colleagues for support and sharing experiences can alleviate stress and foster teamwork. Additionally, setting personal goals and celebrating small victories keeps me inspired and driven, even during tough times. 19. Can you describe a time when you had to advocate for a patient's rights or needs? Advocating for a patient's rights is an essential aspect of mental health nursing. I recall a situation where a patient expressed concerns about their treatment plan, feeling it didn't align with their personal goals. I scheduled a meeting with the treatment team to present the patient's views and needs, emphasizing the importance of person-centered care. This led to a collaborative discussion, ultimately resulting in adjustments to the treatment plan that better reflected the patient's wishes. It was rewarding to witness the patient's increased motivation and engagement following these changes. 20. How do you handle disagreements with colleagues about patient care? In handling disagreements with colleagues about patient care, I prioritize open communication and mutual respect. I first listen carefully to their perspectives, ensuring I understand their reasoning. Then, I share my viewpoint clearly, highlighting the evidence or experiences that inform my stance. If needed, I suggest involving a supervisor or a case review meeting to facilitate a constructive discussion. Collaboration is key, so I focus on finding common ground and prioritizing the patient's best interests, ensuring that all voices are heard in the decision-making process. 21. What strategies do you use to promote your own mental health and well-being? Promoting my mental health and well-being involves several key strategies. I prioritize regular exercise, which helps alleviate stress and boosts my mood. Practicing mindfulness and meditation allows me to maintain a sense of calm and focus in my daily life. I also make sure to engage in hobbies and activities that I enjoy, providing a creative outlet and a break from work-related pressures. Additionally, I maintain strong social connections with friends and colleagues, as sharing experiences and feelings can be incredibly supportive and uplifting in a demanding field like mental health nursing. 22. How do you approach working with patients who have a history of self-harm or suicidal ideation? When working with patients who have a history of self-harm or suicidal ideation, I prioritize establishing a safe and trusting environment. Building rapport is essential, allowing patients to feel comfortable expressing their feelings. I employ active listening skills, validate their emotions, and collaboratively explore their triggers and coping mechanisms. Safety planning becomes crucial, and I engage the patient in identifying warning signs and supportive resources. Regular check-ins and open communication help reinforce their commitment to recovery while emphasizing their autonomy in managing their mental health. 23. Can you explain your understanding of person-centered care in mental health nursing? Person-centered care in mental health nursing emphasizes the individual needs, preferences, and values of patients. It involves collaborating with patients to create tailored care plans that respect their unique experiences and goals. This approach fosters a therapeutic relationship where patients feel heard and valued, promoting their engagement in the healing process. By actively involving patients in decision-making, nurses can better support their autonomy and empower them to take charge of their recovery, ultimately enhancing the quality of care and outcomes. 24. How do you stay calm and focused during crisis situations? Staying calm and focused during crisis situations involves several strategies. First, I prioritize deep breathing techniques to manage my own anxiety. Remaining aware of my emotions allows me to respond thoughtfully rather than react impulsively. I also rely on my training and experience, drawing on protocols I have learned to guide my actions. Creating a safe environment for the patient is crucial. I assess their needs and use clear, empathetic communication to de-escalate tension. Collaborating with colleagues for support ensures we can manage the situation effectively, keeping patient safety at the forefront. 25. What do you believe are the biggest challenges facing mental health nursing in the NHS today? The biggest challenges facing mental health nursing in the NHS today include funding constraints, which limit resources and staffing levels, leading to increased workloads for nurses. There's also a growing demand for mental health services, exacerbated by societal issues like the pandemic and rising awareness of mental health. Stigma surrounding mental health continues to hinder individuals from seeking help. Additionally, the complexity of cases, particularly those with dual diagnoses, requires specialized training and support that may not always be available within the NHS framework. Addressing these challenges is critical for improving patient care and outcomes. In today's discussion, we've explored the top 25 NHS mental health nurse interview questions and provided insightful answers to help you prepare for your interview. Understanding these questions can significantly boost your confidence and improve your chances of success in securing a position within the NHS. We hope you found this content valuable and informative. If you did, please give the video a thumbs up and subscribe to our channel for more helpful resources and tips. Your support enables us to create more content tailored to your needs. Thank you for watching, and best of luck with your interview preparation.